Hi, my name is Tashi.
My name is Fatima.
We're here to do a skit for our farmer project and it's on the drug Warfarin.
So we will be talking about its therapeutic effect, side effect, and client teaching.
Okay. And for this skit, I'm going to be playing the nurse.
And I am the patient who is diagnosed with deep vein thrombosis, and Tashi, the nurse, will explain my medication.
Okay, let's get started. Hi, good morning.
Good morning.
How are you doing?
I'm doing well. And you?
Great. Alright, so my name is Tashi. I'm your student nurse for today. I'm here to administer Warfarin to you, which was prescribed to you by your doctor. Before I give it to you, can I just check your ID, please?
Yes.
Okay. Alright, can I get your date of birth, please?
1964.
Great. Okay, looks good. So I'm just going to ask you a few questions, just initial assessments. Is that okay with you?
Yes.
Great. So I'm just going to take a seat. Alright. Can you give me your full name?
John Smith?
Alright. Alright. Have you ever taken Warfarin before?
No.
Okay. I also noticed you do not have any known allergies. Do you have any family history of diabetes or blood clotting issues?
No.
Alright. Have you had surgery recently?
No.
Do you smoke at all?
Not now.
Oh, so you used to?
Yes.
Okay. And how often do you remember you'd smoke? Like how many packs?
About a pack.
Oh, okay. So I see you have a history of hypertension. Are you taking any medications at the moment to lower your blood pressure?
No.
Great. So your doctor has diagnosed you with deep vein thrombosis. So that's basically a blood clot in your legs. So it's not really dangerous in itself, but once it starts traveling in your bloodstream to your heart or your lungs, that's when it could get a bit dangerous, and that's something we want to watch out for. Can I just see your legs? Is that okay?
Yes.
All right. So I noticed it's a little swollen and it's a bit red, which is common. It's a symptom of the disease. Can I touch it?
Yes.
Do you feel any pain?
Not now, but when I stand and walk, I feel pain.
Okay. So those are the common symptoms of deep vein thrombosis. Now I'd like to talk to you about the drug Warfarin. So your doctor's prescribed 2 to 5 grams of Warfarin a day based on a blood test that measures the tendency of your blood to clot. And it's the international normalized ratio, and it's eventually, as you take Warfarin, you want the ratio between 2.5 and 3.5. So Warfarin is a blood thinner drug based on natural substance found in many plants like sweet clover. So the drug works by decreasing the ability of your blood to clot, and prevents blood clot from forming and growing larger in your blood and deforming all the clots that you have. So are you okay with all the information right now?
Yeah.
Okay.
Yeah.
Okay, so now we can talk about your diet. It is very important to note that you have to avoid vitamin K, which is found in spinach, lettuce, kale, Brussels sprouts. You should also know that alcohol should be taken only in moderate amounts, because having too much to drink can increase the chance of you bleeding. And it can also increase the effects of Warfarin, which is why you would increase bleeding. I'm sure you take aspirin time to time, so you should also know that aspirin can also affect your bleeding as well. Okay.
Okay, what about other medication? What should I do to be safe?
You should probably talk to a pharmacist before you purchase any medication that you're not sure of, just to be safe, and you should let them know that you're taking Warfarin as well.
Okay. Yeah,
Okay.
I can do that, yeah.
Before I continue, can I ask you whether you're planning to travel anytime soon, or maybe see a dentist?
Yes, I'm planning to see my dentist next week, and
Okay.
also I'm planning to visit my daughter in Morocco in 2 months.
2 months, okay.
Yeah.
So that's fine. It is recommended that you carry a medical alert information card that explains that you are taking Warfarin and what your normal INR range should be, so that they know, whoever in cases of emergencies, right? So as for your dentist, you should tell your dentist that you're taking Warfarin, and he should know what to do.
Okay, and for this card, so where can I get it?
We can give that to you with all your information and everything on it.
Oh, sounds good.
Okay. Lastly, I would like to talk to you about the signs and symptoms you may experience because of this drug. There could be severe headache, weakness, numbness, coughing up large amounts of bright red blood, vomiting blood, sometimes bleeding that will not stop, you would be able to notice any of these. And if any of these do occur, it's advised that you should call 911 right away. And if you're in the hospital, then just call any of the nurses and we'll be right there to help you.
Okay, so that seems scary, but I can tell if there is something not normal, then call you right away.
Okay.
Thank you very much.
You're welcome. Do you have any other questions that I can answer for you today?
No, I think that you covered everything.
Great.
Thank you very much.
No worries. So I'll just give you your med and then I'll let you rest.
Yep.
Okay. And there you go. So here's your warfarin.
Thank you.
Your water. Great. You're all right?
Yeah, thank
Okay.
you.
So if you have anything that you need help with, here's your call bell. I'm just going to leave it right here.
Yep.
Okay. Do you want me to lower down the bed for you or anything like that?
That's fine. You can just adjust.
All right. Great.
Great. I'm okay.
So if you need any help, just call me.
Thank you very much.
You're welcome.
Rashi.